What's your name and occupation?
My name's Julio. I go by JR. I'm actually a full-time student, so I'm attending the nuclear medicine technology. It's a bachelor's degree, so it's a 4-year degree.
Oh, okay. I was just about to ask what education you need. So bachelor's degree?
Yeah. So first, for that Loma-Linda program, usually their radiology programs, you have to go to a JC, so a community college, to finish up some prereqs. Usually your anatomies, physics, chemistries. Then you'll go apply, and at their program, once you get accepted, it's a 2-year program. Sometimes, like my program's 2 years and like 2 quarters, so it's a little over 2 years.
And how much does all that cost?
Oh, it's about 44,000 some change. We usually round it up to about 45, just because you do have to take a EKG class that Loma Linda doesn't offer. That runs you about $200, and your scrubs and stuff like that. So you're looking at about 45,000 for 2 years, so about 90K. About 90K. So.
God damn! And once you're a nuclear med tech, how much money can you make?
It starts off usually at mid-40s, but I've seen all the way up to about 80 bucks an hour.
God damn.
So the program at Loma Linda, you'll get a bachelor's for your CT, but you're able to sit down for your PET and CT. So by the time you graduate, you have 2 modalities under your belt.
Some great info right there, man. So for people who want to go into radiology, but they just don't know which modality, what do you recommend?
Definitely do your research. So I've always wanted to be involved in the medical field. I didn't know what to do, so I started looking into radiology. I was fascinated with ionizing radiation.
Yeah.
And so there's definitely a lot of room for growth. So you have your sonography, you have your cardiac electrophysiology, you have my program, you have CT, X-ray. So you get to see different diseases that might fascinate you and intrigue you. At the same time, you're able to deal with different patient care. So with like sonography, you'll be more one-on-one with the patient. You'll spend a little more time with patients. And then you have like mine, you'll spend a couple minutes with the patient, starting in IV and stuff. But most of the time will be spent with the camera. So it just kind of depends what type of patient care you're looking for and what type of education you're looking to kind of achieve. So.
And as a student at Loma Linda, what are something that people never told you about this nuke med program?
How hard it'll be. So the type of class you go through, again, it's a lot of math, a lot of science work, but at the same time, it's a lot of writing. So for example, this last semester, it was back to back writing papers about leadership, morals, ethics. So it's a lot of time. It's time consuming and a lot of time management skills that you have to take into account.
Damn, see, I just thought it was going to be like physics and stuff, but there's a lot of stuff going behind the scenes.
Right.
So for anybody watching, you have any words or to inspire people watching?
First of all, don't be afraid to go back to school. I just turned 30 this year. Before I was going to school for business and whatnot. And, life happens. And something I was told is that at the end of the day, I'm trying to get into medical school as well. So at the end of the day, I'm either going to be 35, 36 and a doctor, or I'm just going to be 35 and 36. So don't be afraid to chase your dreams. Don't be afraid to go back to whatever makes you happy.
That's some great advice right there, man. I always tell people, get your ass back to school because you're going to be that age regardless.
Yeah.
That's a lot of wasted time that you could have already been
steps ahead. Yep.
That's some good info.
Yeah.
Appreciate your time.
Yep,
guys, follow him right here, his Instagram. So